Hey guys, welcome to the Pregnancy Nurse Chat of the week. I was on last night. I had so many good questions. How's it going today? I am planning to make some rolls in a little bit. Do we have any bakers on here? I've been making pins for Pinterest, a lot of them about winter stuff like colds and coughs during pregnancy and can coughs induce labor? All sorts of wild and fun stuff. So that's what I've been doing today. Tell me what you're up to. Ask me your pregnancy questions. I'm here for a little bit and excited to answer them. Yeah. Let's see. Coughs and colds in pregnancy. Can we talk about how dehydrated you can get so fast during pregnancy? It really does feel like the baby is a little bit of a parasite. Maybe that's just me, but I ended up having to get an IV bag with my last pregnancy, and oh my gosh, I felt so much better after. I was shocked. Is this better lighting if I do this? I don't know. Anyway, so has anybody had cough colds during pregnancy? Tell us in the comments. It's miserable. They're just like worse than when you're not pregnant. Is it just me? I just feel like they are. There's a few of you guys in here, so if you have pregnancy questions, ask them in the comments. Or tell me how you are preparing for your upcoming birth if we haven't met. Hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, The Easy Way to Get Prepared for Birth. It is an online virtual birth class that you can take 24 hours a day, 7 days a week. If you want to find me, it's Sunday at 10 p.m. I will be waiting for you. So come join it. You can get 10% off right now with code FASTERBIRTH. I'm 10 weeks postpartum. I'm scared of pregnancy again. LOL, but it was beautiful. Yeah. I mean, fair. After my first baby, I was scared of pregnancy for a while. Tell us in the comments if you're feeling a little nervous about pregnancy after having done it once before. It can be a lot. It's a lot of feelings. Much like everything lately, so many feelings. But usually it's easier the second time. In some ways it's harder. Definitely pushing's easier the second time, usually. I shouldn't say that all the time, but often it is. Yeah, how's everybody feeling today? What's your favorite part of being pregnant? Tell us in the comments. I sure am. I'm 32 weeks with my second. Yeah, Kayla. It's a lot. And then you have the other kid that you have to like take care of. It's a lot. The good news is they usually can pick up stuff off the floor for you because reaching the floor is very, very difficult. Yeah. Did you know that even if it's your second baby, I still recommend a birth class? I have a shortened condensed one of mine that's only $89 minus 10% with code FASTERBIRTH that you can come join, kind of get a refresh, remind yourself about those hospital procedures. I was just in a discussion with some people who were saying that your doctor basically shouldn't tell you if you have a big baby because it will make you want to be induced. And I was like, no, you need to understand that it's your doctor's job to do that, what informed consent looks like, because it can be kind of scary if you don't understand it. And then you got to learn how to make your own choices and ask questions that will help you make your choice. So taking a birth class helps you do all that, but taking a good birth class, because the birth class I took with my first was not that. Thank you. Alyssa says, oh, did I miss somebody? Okay, I got that one. Alyssa says, oh, I hope I ripped even though he was a tiny baby. Yeah, most people rip on their first baby, which you do not see often on social media. It seems like everybody's like, oh, if you do perineal stretching, you won't rip. Sorry, guys. You won't rip big, but you might tear a little bit. So it's very, very normal. I miss the kick so much and the rolls. Yeah, there's a lot to miss about being pregnant, getting your period. You guys, and you're asking if you're pregnant, as if I know. My first will be 3 on the 26th, and then you're pregnant again, Kayla? So I had fluid randomly coming out. Not sure if my water broke. I didn't go to the hospital at all. I'm guessing this was a while ago. If you just have one random leak, most likely that's not your water breaking. It could just be discharge, or it could be urine. Usually, if your water is broken, but if you have any questions, you should go into the hospital or call your provider. Usually, if your water is broken, it's going to keep coming out because most of your water is baby pee. It may not gush out, but you should keep getting a little leak. You know, if you're walking around in a half an hour, your panties should be wet. Yeah. Kayla said she's measuring a week ahead, but they said they aren't changing my due date since it's not 2 weeks ahead. Yep, very normal. They usually do not change due dates after that first one with the ultrasound. Nessa says first for 36 weeks, currently 35 weeks, and hoping this one stays in longer. Okay, so you had your first one at 36 weeks and you're 35 weeks. You are more likely to have preterm labor if you've had it in the past. Have they check your cervical length? You just got to keep an eye out for it. Doesn't mean you are going to have preterm labor. I've had plenty of patients who, you know, first one was like at 34 weeks and then they go to like 38 with the next one. So thank you guys for all the likes for this live. It really helps. Tay said no 2 days ago. It had no smell. So just keep watching. If you feel like fluid's coming out more, you'll want to talk with somebody, I think your provider or something. The good ask your so a lot of people are like, oh, you've got to go to the hospital for that, but a lot of providers have a test that they can do in the office. And if you can be tested for anything in the office, I am 100% behind getting it tested in the office, because the hospital takes a long time and I'm never sure how much we end up charging you. And you can get your same question answered. Whereas when you come to the hospital, we have to do a full admission every single time. We have to do an NST every single time. Your regular OB doesn't have to do that. And I give tips like that, by the way, guys, in the online prenatal class for couples. I went into preterm labor with my first. It was very rushed. Yeah, it can feel super, super scary. Cervical length was normal. They have no idea why baby came early. Very strange. Some babies. I mean, you may have had an infection or something last time that may have mitigated. It's really hard to know after the fact why baby came early. So, yeah. I got my membranes scraped with my first, and he came at 39 weeks. I'll probably do it again. Yeah, so the studies on membrane stripping show that it may work some of the time, but not all the time. I had my membrane stripped with all of mine. It only really worked with one of them. So I think if you're ready to go into labor in the next day or so, sometimes it bumps you in. Yeah. If you soak a pad in an hour, I would definitely be concerned. Yeah, that is definitely a reason to go in. Also, 36 weeks baby labor was 2.5 hours total, so I'll be close to the hospital this time. That's awesome. Smart move. What's the chance of miscarriage at 10 weeks pregnant, 25 years old, non-smoker, and healthy BMI? I do not know. And as I know you want to know like the studies, and that totally makes sense, but studies can't predict exactly what's going to happen in your pregnancy. So the best thing you can do is try and be hopeful and stress as little as possible. Lorena, first kiddo had a 4th degree tear. Oh, the worst. I will say that I tore a lot on my first, but it was a forceps delivery and did not tear near as much with my second. Although, once you tear once, you're more likely to tear the next time, they say. Just you kind of think of it as like a nick on fabric. You know, if you nick it, it's easier to tear. Same kind of idea, but I don't like to think of my perineum as like that. Brooklyn, do you know anything about GD? Got diagnosed at 25 weeks. My numbers have been good, but I'm nervous. So Brooklyn, if your numbers are looking good, that's awesome. If you keep your gestational diabetes diet controlled really well, then, you know, your risks are very minimal compared to like anybody else. So that's awesome. Keep it up. Yes, 4th degree. Oh, ouch. Do you guys know how to take care of your bottom after you have a baby? That's super important to know. I go over that in my class. I have a video on YouTube about it because I had no idea all the things I was going to do when I'm in the restroom, and how important cold is, and making sure that your stools are soft and things like that. It's so important to know things like that. That's why I always recommend taking a prenatal class. Mine is called the Online Prenatal Class for Couples. You can find it through the link in my profile, and you can save 10% today with coupon code Faster Birth. Alyssa said I had to get them vacuumed. I don't think that helped my tearing. Yeah, a lot of times vacuum forceps, you're more likely to tear more. Does flying on a plane have effects on a barely 1 month pregnant woman? Most often not. You want to make sure if the flight's long that you get up and stretch your legs. I would probably wear compression stockings because you are at a higher risk for blood clots throughout your pregnancy. But no, plenty of people fly early in pregnancy and don't have an issue. Hopefully you're feeling well overall. My last pregnancy was at 20 years. I'm 34 now, bounce back quick. Will it take longer to recover? I mean, probably, Anna. You're just older, but you're going to know more. You're probably going to have more support, maybe. So there's that. I would totally recommend making sure that you have a postpartum plan, which I talk about on the Pregnancy Nurse. You can find that post on that website, where you kind of think about all the support that you're going to get after you have a baby. Yeah. Dermaplast was your BFF. Yes. And I actually love Dermaplast, especially when it starts to heal and itch. Super helpful for that. Brooklyn said, I had preeclampsia with my first, not with my second, but I know with GD increases the chance of getting it again. It can, Brooklyn. Are you taking aspirin? Did you guys know that aspirin is recommended to be started by like 12 weeks, I think, of pregnancy, if you can. But talk with your provider. It's if you have an increased risk of preeclampsia. So talk with your provider. Even if you're not seeing your provider till after 12 weeks, ask them on the phone when you make your appointment. It decreases your risk of getting preeclampsia. It decreases the risk of severe preeclampsia, and it can often prolong how long it takes to get preeclampsia. I'm 26 weeks and my baby movements have slowed down. So prior to 28 weeks, and for the most case, it's too hard to track fetal movements because they don't really have a pattern, because sometimes baby might be behind the placenta and they're just too small to make their movements known. Molly on Instagram, do you ask questions on here? You sure can, Molly. That's what I'm here. I'm answering questions. Yes, Brooklyn. So hopefully they have you on aspirin. if that's safe for you. If you have a history of gastric bleeding, gastric ulcers, other types of bleeding disorders, then they wouldn't have you on it. So Petty, I think it's Petty or Pretty. You want to make sure that you start the kit counts at 28 weeks. If you feel changes in fetal movement, that's worth it to talk with your provider, but it's just so hard to track them prior to that, I think. Yeah, you can always call your provider, but most often they say it's too hard to track fetal movements prior to 28 weeks. Is it okay to not gain weight for 3 weeks? Molly's asking this on Instagram. I'm 27 weeks pregnant. Molly, it's not super unusual, especially in the middle of pregnancy. Baby's not growing a ton. You're just kind of like building organs and stuff like that. I mean, make sure that you're still eating the rainbow. You're eating a nice, healthy diet, well-rounded, and just keep an eye on it. That's what I would do. 42 on my last baby on Lovenox and aspirin, trying to keep her in as long as I can. Yes. Hang in there, Jenna. That is good times. What are the chances of a successful pregnancy with 2 fibroids? I do not know that one. That would be one to ask your provider. It really varies on your obstetrical history and all that. Molly said, thank you. You guys are so welcome. In case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am the creator of the online prenatal class for couples, the easy way to get prepared for birth. And I know meeting me on here is so fun, and I love answering you guys' questions, but you really need to know the basics from pregnancy. I start in your 3rd trimester and what to watch for, as well as testing they might offer. Laboring, especially laboring at home, because that can make or break a pregnancy or a labor. Birth, like what's going to happen at the hospital, understanding natural pain management, your like epidural or medical pain management options, inductions, C-sections. And then we have 2 chapters on postpartum, because I think most prenatal classes just gloss over that, and that is not doing anybody any favors. So come join me in there. It's available 24/7. And today you can save 10% with coupon code FASTERBIRTH. All one word. I had a miscarriage last pregnancy. I'm 18 weeks now, and I'm kind of in the clear this time. I mean, you're never in the clear. I wish I could say that, but your chances of a miscarriage are much less after your 1st trimester. So that is awesome. Congratulations. I'm 35 and 27 weeks. That's awesome. You're headed into the 3rd trimester, Sagittarius, which means you're going to want to start to do kit counts. If you don't know what they are, I have a cheat sheet under freebies on my website. Jesse said, I have a ton of pelvic pressure at 33 weeks. Yep, baby is starting to burrow down into your birth canal. 33 weeks, by the way, is a great time to get a birth class in. Can your water break prior to contraction starting, or will contractions usually start first? Usually people are in labor and then their water breaks, but sometimes their water just breaks out of the blue. And yeah, I think a lot of people find that, oh, that cramping was contractions. They didn't really notice it until their water broke. But most people's water does not break at home. It waits to be broken until you get to the hospital. Your provider does it in the hospital. I think it's 10 to 15% break at home, and then everybody else's is broken in the hospital. They also mentioned that I have to UTI at 26. Any natural remedies I can do? I have no symptoms. As far as I know, for a bladder infection, the main remedy is antibiotics, which I would consider taking because it can put you into preterm labor. Somebody said their cousin is having a water birth and I'm going to help her, but I'm scared. I would guess that's a home birth, and I don't have any experience with home births. When does the first trimester start? The first trimester lasts until 13-ish weeks. Second trimester lasts from 13 to 28 weeks, 27 weeks. And then the last trimester is 27 till delivery. And third trimester is when you do your kick counts, and our recommends picking out your birth class at about 20 weeks and getting it done by about 34 weeks. But the good news is the online prenatal class for couples only takes about 3 hours. So it's super easy to do whenever you're ready or whenever you get it. Heartburn in first trimester, how does a person deal with it if Tums and I'm guessing Rolaids don't work? There are medications they can prescribe, but you want to talk with your provider. Pepcid, Prilosec. Can't remember the name of it, but there are other things that they can do. What exercise should I start at 20 weeks? That's a good one to ask your provider because it's kind of based off of how much you exercised before. I always love stretching during pregnancy. I think that'll be really helpful. And I'm a big fan of exercise during pregnancy, about squats, especially in getting your hips to open up. I think OBGYN just guessed the week month pregnant because I was irregular and I don't know my last period. Sagittarius, did they do an early ultrasound? Because usually they base it off of that. Like Nexium, that's one too for heartburn. How can I have a natural birth after C-section last year? They told me I can go natural. Now, Slim Mammy, natural is different for everybody. Are you talking about no IV pain medications or pain management, or no induction, or just not having a C-section? Yes, you can. I have a whole post on 5 things to think about before you have a VBAC, though, and I think it's really important to think about those and discuss them with your provider before you make a choice as to what you do. And of course, you can change your mind. If you think, yeah, I'm going to go natural. Ooh, I did not want to invite anyone as a guest. Sorry about that. Natural birth, no C-section. So that's called a TOLAC or a VBAC. And yes, you can do that. Molly Boyle, do you think it could hurt the placenta? This is on Instagram. If someone jabbed their fingers in my stomach, I have an anterior placenta. Most often, no, because you've got to think you've got the visceral fat that you have, the uterine wall. I mean, unless they're hitting you really hard, it shouldn't be a thing. But if they're hitting you hard, then that is another issue, Molly, and we want to make sure that you're in a safe place for you and your baby. Anyway, thanks for joining me here, you guys. If there's any more questions, I'd be happy to answer them. Otherwise, I'll probably jump off. Once again, I'm Hillary. I'm the pregnancy nurse. I'm your bump to bassinet bestie, and I would love to see you guys in a birth class. I just saw a post here on TikTok where somebody was saying that people only think they need a birth class if they're planning to go natural. And she was like, that is not it at all. And I cannot agree anymore. There's so many people who think a birth class is just about breathing. And I'm here to tell you that it is not. It is here to give you realistic expectations of what to expect. It's here to give you tools to talk with your provider about you and your specific circumstances. It's here to talk a lot about what's normal, so you don't have to waste your precious prenatal appointment time on that, and you can dig into what's normal for you. That's really what a birth class is. I'm not saying I have a whole lesson on natural pain management techniques and I'm not saying that that's not important, but it's not the main thing. And for a long time, I think doctors were like, sure, do a birth class that's on just pain management, because that really wasn't their thing anyway. They didn't want you to talk about how to get more information about the studies and stuff like that. They kind of wanted to push you around, but a good birth class is going to teach you how to work with your provider to get the information that you need. Slim Miami. Oh, so okay, so you had 3 vaginal deliveries and then you had an emergency C-section. I would say that most often then you're a great candidate for a VBAC. But it also depends on how they did the surgery. If they feel like you're a good candidate, then likely you will be. I'm 35 years old and 4 weeks. When would be the best time to test? You mean you're 4 weeks along? You want to test when you would have had your period. Sagittarius says stay longer. Girl, there's no more questions. It's just awkward. Oh, Molly said her mother-in-law did it to get the baby to kick. No, if they're just like that, you should be good, especially if it's just like one finger. If it's like this, then we need to talk about safe spaces to have you and your baby in. Okay, last call for questions. Come join me in the online prenatal class for couples, though. We answer so many questions in there. If you have any questions about my birth class, I'm always happy to answer them. You could ask them on any of my videos. You can DM me, although I think DMing me on social media is sometimes difficult because it is. But anyway, I'm so glad that you guys were here. It's so fun to answer everybody's questions. I love coming on these lives. Oh, we have one more. I've had 2 C-sections. I feel like because I've only ever had C-sections, I can't have a VBAC. So ACOG, which is the American College of Gynecologists and Obstetricians and Gynecologists, says that 2 VBACs is, if 2 C-sections, you can try for a VBAC. If you've had 3, it's done. But a lot of people really like that they can plan out a C-section and they know how to do it. So if that's you, I think that can be fine also. It also really depends on why you had C-sections on the other times. If both times like baby couldn't progress or anything like that, then maybe that's just a sign that a C-section is going to be easier on your body. So talk with your provider about it. If you guys have more questions, go to the pregnancy nurse, search VBAC, and it's going to come up with the questions you should be talking with your provider and thinking about on your own. How often would you suggest labs with previous miscarriage and cervical cancer? I mean, the cervical cancer, they usually do a pap smear at the beginning of pregnancy. I think you'd be on the regular lab schedule. I don't think it would change anything, but I don't know. Definitely talk with your provider. Remind them of your history, because it's really easy to forget as a provider. So remind them of your history and see if there's anything they want to change. And ask them at your appointment. And if they're like, okay, yeah, but at 28 weeks, we're going to want to get XYZ, put a note in your calendar so that you guys know neither one of you forgets. I'm a regular and trying to conceive, but do ovulation tests work? I didn't personally ever use ovulation tests. A lot of people say that they do work. I just took my temperature every morning and that did work. So there you go. I've advocated for extra labs and got denied. Yeah. I mean, doctors can only do what they can do. I don't know. I'm not sure what extra labs you would get. Like, I don't know if you're looking for like progesterone levels or what, but there really isn't too much they can take that will look for miscarriage issues early in pregnancy. So God bless. Yeah. I don't know how some doctors order a ton of progesterone levels and some don't. I don't really know how that works. What works for nausea in the first weeks of pregnancy? Eating small, frequent meals, carbs, just see if there's anything good to eat. And then talk with your provider. There are medications they can recommend. I can't recommend medications, but there are things they can recommend. Are there free questions like on this live? You can ask a question. Sure. Anyway, Big Jada, a lot of times just talk with your provider. Ask for things to fix it, because yeah. Am I allowed to eat cold ham just a few weeks pregnant? I mean, you're allowed to do whatever you want. Studies show that ham can cause listeria, which can get to the baby. And if it does get to the baby, it can be really problematic. So personally, I wanted deli meat so bad. I would put it in the oven with some cheese and broil it till it was steaming and then put it on a sandwich. because that would kill the listeria. So you just want the meat to be steaming. You can obviously do whatever the heck you want, but that is the recommendation. And yes, I did get a cold deli sandwich soon after I had my baby because I just wanted that so bad. I'm sure it was because I couldn't have it, but boy, oh boy, did I want it. Anybody else want a deli sandwich? Anyway, thank you guys for coming on. Oh, is it okay to breastfeed your toddler while pregnant if you have your baby at your first baby at 35 weeks? That one's tricky because you definitely don't want to start any preterm labor. I would talk with your provider about it and see maybe when you should stop, because usually at the beginning you should be fine. A lot of times people's milk just dries up and it just naturally kind of ends. Do you recommend the RSV vaccine? I know that it is a recommendation of ACOG. I can't remember how many weeks you can get it. And I know it's the recommendation of the American Academy of Pediatrics after birth if the mom didn't get it during pregnancy. But I know it's been real tricky for people to get. So that's a bummer. Thank you guys so much for the likes. Yeah. Oh, by the way, all my breastfeeding stuff, I send people to the Breastfeeding Mama. She's on all the social media. It's Katie. We're real life friends. I think she gives great pregnancy advice. So if you have questions about breastfeeding, she's your gal. And I know she has information on breastfeeding while you're pregnant. So anyway, thanks for joining me. I would love it if you guys came and joined me in the online prenatal class for couples where we answer even more questions, and you can hang out with me there more. Remember, you can save 10% today only with coupon code FASTERBIRTH. Thanks again for joining me. I wish you guys the very best. I hope you have a great pregnancy.